I'm Courtney Wagner, and this is In the Game. I'm here with orthopedic surgeon of the Jacksonville Orthopaedic Institute, Dr. Carlos Tandron. Thank you so much for being here.
My pleasure.
So I know you're a founding member of this institute. What does that feel like?
Well, we started 22 years ago as an idea. There were three of us that started it. And it's been really kind of cool to watch it grow and expand and provide services for all of Northeast Florida. And in the interim, adding many, many physicians with different specialties. So it's been a cool environment, a cool setup for us.
Absolutely, to be the start of something that's so amazing and impacting so many lives. And I know you said, you've lived everywhere from Cuba to Miami to Atlanta. What do you like so much about being Jacksonville here and serving your local community?
Well, Jacksonville itself is really like a big city, but small town atmosphere. And that's what I enjoy the most, is the small town atmosphere. Because I run into people all the time that I've taken care of, or family members that I've taken care of, which is kind of nice.
Absolutely. I know you work with Bishop Kenny, you work with the Jacksonville University, Florida State College of Jacksonville. What's it like having such an impact of all of our community members?
I don't know if I'd call it an impact. I know I get to touch a lot of different lives. I've been doing it for 29 years. And you start with the athletes, but you also get involved with their families. And what's really pretty cool is when the families come back and see you for other things. Or the kids you've taken care of are now in their 30s and come back with their young children.
Yeah. So do you see a lot of that full cycle, kids you used to take care of and now you're taking care of their children?
Oh, absolutely. Absolutely. Unfortunately, some of the same injuries that I took care of in their parents, the 15-year-olds and the 16-year-olds are suffering now.
Oh no, so it runs in the family a little bit.
Well, they're active.
Which is great. We love activity, and then, the great surgeons here who take care of those athletes. So I know you were a physician for the Jacksonville Jaguars for 18 years. How was that experience?
That was a fun experience. I enjoyed my time doing it. I think I touched a lot of the players well. My relationship with Wayne Weaver and Dolores Weaver were wonderful people. It was probably one of the most exceptional parts of the job. I got to take care of them professionally, both the athletes and the families. I enjoyed it, and it was time to do something else after a while.
Yes, I was going to say, is there a certain season that really stood out to you that was your favorite? And I know you just mentioned those two athletes specifically.
Season-wise? No, actually, each season, it was like one long season, if you would.
Yes, yes.
Winning seasons were fun. Even losing seasons were fun in a way. Just being able to provide care for them was interesting.
And was there kind of a common injury you dealt with the professional athletes in comparison to the day-to-day injuries you come across?
Not really.
Okay.
I mean, their injuries are no different than what I see in my daily practice with the college athletes and the high school athletes.
So whether you're high school or professional, a lot of the same things you're seeing all the way around.
Correct, as far as injuries go.
And as far as needing a shoulder or knee replacement, because I know that's something you really specialize in as well, what are some of the common causes you see that cause those injuries?
The most common need for shoulder knee replacement in my practice is really just plain wearing out, osteoarthritis. But the differences are, a lot of us are wearing out a lot sooner. So we're having the younger patients come in their 40s and in the early 50s, where they need knee replacements and shoulder replacements, where years ago they were in the 60s and 70s. And is it because of how much we're doing, or is it just trauma over time?
Sure.
I'm really not sure of the answer. The good part is we're able to offer different opportunities, different type of procedures for the younger patients that we didn't have 20 years ago.
Sure.
That's really the exciting part of orthopedics, being able to offer up-to-date services that are just getting better every year.
Absolutely, and the best technology. Is there any advice or precautions you give these candidates to kind of avoid the future injuries that might come if they're a little more prone to it?
So I think stretching and flexibility is extremely important. Maintaining muscle mass and strength is extremely important. And in some patients, it depends on the type of patient, limiting impact is important. Whether it's impact to the knees, the hips, or the shoulders.
And what sports injury do you see most commonly?
In my practice, it's usually shoulder and knee surgery, and for me, it's a labral tear or instability of the shoulder. I do a lot of overhead athletes, such as baseball players, overhead football players, volleyball players, so a lot of labral pathology. In the younger group, as they get older, I see more rotator cuff injuries and rotator cuff repairs. That's where you tear the tendon away from the bone.
Sure.
In the knee, it would be more ACL reconstructions, where you tear the cruciate ligament plane of sport and fixing that. And as far as replacements of the knee, it's probably more common than shoulder replacements for me.
Okay, and what is your favorite part about working with the Jacksonville Orthopaedic Institute, the place that you founded and started?
Coming to work every day. You get to touch people's lives and really help people out. It's really pretty nice.
Well, thank you so much for being here, Dr. Tandron. We really appreciate it and everything you do for this community.